Hi everyone, this presentation covers Chapter 29 on Descriptive Statistics in the third edition of Jacobsen's textbook, Introduction to Health Research Methods, a Practical Guide. In this chapter, you will learn that descriptive statistics such as means, medians, proportions, and standard deviations are used to characterize the distributions of quantitative variables. Here's an outline of the chapter. Section 29.1 covers analytic plans by study approach. Section 29.2 covers different types of variables. Section 29.3 goes over measures of central tendency. Section 29.4 covers ranges and quartiles. Section 29.5 goes over displaying distributions. Then section 29.6 goes over normal curves, variance, and standard deviations. Section 29.7 goes over reporting descriptive statistics. Section 29.8 goes over confidence intervals. Section 29.9 goes over statistical honesty, and Section 29.10 goes over statistical consultants. So section 29.1 covers the analytic plans by study approach. So the field in public health that typically the analytic plans are created by are biostatistics. And biostatisticians use biostatistics when trying to take any sort of data analysis into consideration, and also epidemiologists do as well. But biostatistics is the science of analyzing data and interpreting the results so they can be applied to solve problems related to biology, health, environmental science, or related fields. So you may be wondering what the difference is between statistics and biostatistics, and really it's just a matter of the health or biological related outcomes that are being analyzed in statistics, but the methods are the same as any other type of statistics. And so when you first do any sort of statistical analysis, you do a univariate analysis. And so this is the analysis that describes one variable in a data set using simple statistics. So this is just one characteristic of a population that you're looking at. And this may be counts or frequencies. So the number of people that have, say, a certain disease or outcome, proportions, which can also be presented as a percentage, and averages, which is also called a mean. And so for studies with no comparison group, say a case series or perhaps a cross-sectional study, a univariate analysis may be the sufficient statistical analysis plan that you can conduct. It may be that you don't need any more advanced statistics, say if you're doing a needs assessment of a population, because you only need to know what their needs are. You're not comparing them to anyone else, you're just describing their needs. Whereas bivariable analyses, or a bivariate analysis, you may also hear it called, looks at more than one group. And these are the analyses that are typically used in epidemiology, rate ratios, odds ratios, and other comparative statistical tests used to examine the association between two variables. And so these usually have two groups, and you usually compare more than one variable. You usually have at least one independent variable that you're comparing with an outcome, but you may have others. And so a cohort study and a case control study are commonly used. The bivariable analyses are commonly used in these study designs. And so a cohort study may compare the rates of disease incidence among the exposed and the unexposed, whereas a case control study may compare the odds of exposure among groups with and without the disease. Multivariable analysis uses multiple different variables, and typically they will have some sort of regression analysis, which is covered in a different chapter, to look at relationships and predictions between one variable and a specific outcome while adjusting for other variables. So it could be that you're looking at differences in Alzheimer's disease and related dementia prevalence among racial and ethnic groups. The race and ethnicity group is your independent variable. Your Alzheimer's disease and related dementia is your dependent variable. And if you adjust for things like age and sex, those would be your adjusted covariates in a multivariable analysis. And so this is a little bit beyond the scope of a bachelor's level course, but we will talk a little bit more about regression in a different chapter. So figure 29.1 goes over some different analytic plans. And so here we have the study design related to each of the different plans. Now this is not set in stone. You can use different analytic plans for different study designs. But for example, a case series, if you're just describing a series of cases, you're probably not going to need more than the univariate analysis. A cross-sectional study, I would argue that a lot of times you will look more beyond a univariate analysis and do a comparison between two groups and regression and other advanced analysis with multivariate analysis there. Then the case study and or actually the case control and the cohort studies typically use a bivariate analysis, but you probably will be doing some sort of multivariable analysis as well. And so here in the figure, the solid line is what's most commonly used, but then the dotted line is showing that it could be used in those other study designs. But as I said before, a cross-sectional study can also use a multivariate analysis. So what are variables? So section 29.2 covers the different types of variables. A variable is a characteristic that can be assigned with one or more value. So if it is sex assigned at birth, you may have 1 equals male, 2 equals female. If it's an age, it could be an age category, say 18 to 22, 22 to 25, or it could just be the number. That a continuous variable is a numeric variable that can take on a value within a range. And so there are two different types of continuous variables. There are ratio variables and interval variables. A ratio variable is a numeric variable plotted on a scale of which a value of 0 indicates the total absence of the characteristic. So an easy way to remember the difference between the two is that ratio has the O on the end of it, which is like a 0, and so it has a value of 0. Whereas the interval variable is stating that the value of 0 does not indicate the total absence of a characteristic. And so the difference there being like temperature. So if you're on a scale where 0 means absolutely no temperature versus 0 being freezing, the Celsius versus Fahrenheit. But the bottom line in public health is that these variables are analyzed very similarly. There's not really anything different that you would do based on whether something's a ratio or interval variable. Then we have discrete variables, and these are categorical variables. This is really any numeric value that's not continuous. And so if you have a value for different groups of people, so say we have age and we group it as 18 to 25, 25 to 35, 35 to 45, your value is going to be different within that. However, that value is actually a ranked value because it has a more or less than a relationship. So an ordinal variable is any variable with responses that span from first to last, best to worst, most favorable to least, always to never, or any other type of a ranked scale. There's actually a value to it. Versus a nominal variable, there's no more or less than relationship. So things like sex, things like race and ethnicity, or if you're just characterizing people, so people that live on campus, people that live off campus, people that live in a certain dorm, people that don't live in dorms, those don't have one's not better than the other there versus an ordinal variable where there is a more or less than relationship. Then we have dichotomous and binary variables. And so a binary variable really has two possible responses. So you will hear these used interchangeably. Dichotomous, binary, it's just one or the other. And then a binomial variable will probably also be called dichotomous or binary, and this is where they are coded 0 to 1. So when I work with students, I always recommend that they code a 0 for no responses and 1 for yes responses, or no for do not have the disease and 1 that they do have the disease. And then it makes it a lot easier for the analysis. And so figure 29.2 goes over each of the different variable types, definitions, and some different examples. So for ratio variables, some examples include blood pressure, height, and weight. For interval, it includes that temperature variable. For ordinal or ranked variables, something like highest level of education or different Likert scales. A nominal or categorical variable, things like employment sector or blood type, and then binomial being yes, no, male, female, or case or control. So section 29.3 covers measures of central tendency. And so central tendency refers to the center of the observation. And so if you just think of central, it's the center of where observations lie. And there are 3 different ways to describe measures of central tendency. So first we have the mean, which is the average, and this is where you add up all the values of a particular variable and then you divide by the total sum of individuals for that value. Next, we have median, and this is where you list all of the variables in order from least to greatest, and then you report the middle number. If there is an even number, the middle would be the average of the 2 in the middle. And then the mode is the most frequently occurring value for a particular variable in a data set. So figure 29.3 goes over some examples of how to calculate this. And so here we have some values of 6 different participants, and they are not lined up in order. But if we did the mean, we would just take all of these, add them together, and divide by 6. For the median, you have to put them in order, so you'd have to go 25, 30, another 30, 40, 50, and then 62, and then see where the 2 middle values are. And the middle value is in between 30 and 40, so the median is 35. Then the mode is any values that are more than the other. So there are 2 30s in here, so your mode is 30. Next, we go over range and quartiles. So we talked about the distribution based on the center of the observations. Now we're talking about the spread or measures of dispersion. And this really is measured through variability and range. So variability is the extent to which the values of a particular variable deviate from the average value of the variable in the data set. So that's how far each variable differs from the average. So in the previous slide, it showed the average was around 29.5. So the variability for the 30 response is not much it's not much different than that 29.5. Whereas that individual who is 62 has a lot more variability between that and the center of the observations. And so the variability is looking at all of them and how much they all differ. And that's through the measure of spread. So that describes the variability and distribution of values for a numeric value. And for a particular variable, the response with the lowest is the minimum, and the response is with the highest is the maximum. So if our lowest value is 25 and our highest value is 62, then the variability is between the two, and that's the range. So you would take the 62 minus the 25. Next, we have quartiles. So quartiles are the 3 values that divide the data set into 4 equal parts. And so it's really just taking the top 25% and then going and creating it into quarters. Then the interquartile range captures the middle 50% of values for a numeric variable. So section 29.5 goes over displaying distributions. And so displaying distributions, you can put your data in tables, but it can also be displayed by graphs or figures. And one way of doing that is through a histogram. A histogram is a graphical representation of ratio or interval data. So this is used for continuous data. And the x-axis shows the values of responses, and the y-axis shows the count for each of the number of times each response goes in the data set. And so each bar should have the same width, and there should be no gaps between the bars. And so here's an example of a histogram, and it has the different responses. So if this is age, then here you can see there's one response for age 22, one for 25, and then you have two for 27, you have four for 28, and so forth. And then here you can see how there were 37 in the sample size, and if you added them all up, you'd get the measures of central tendency as well as variability, spread, dispersion there. Then we also have a box plot. Sometimes this is called a box and whisker plot, and this is a graphical depiction of a numeric value that shows the median, the interquartile range, and any outliers. So this, instead of being continuous data, this is typically showed for categorical data that's maybe ordinal. And so here you can see the median based on the data that were in the previous is right here. Then you have the 25th percentile here, 75th percentile here. You have a couple outliers up here, and then it shows that most of the observations lie within this range. Then we have a bar chart, and this is very similar to a histogram, but there is actually spaces between them. So the bar chart is a graph that presents categorical data using equal width rectangles and lengths that are proportional to the values they represent. So one axis is the number line and the other displays the categories. So typically the x-axis displays the categories, but you can present it the other way. Categories are represented by bars and may appear in any order, so it doesn't matter the order they're in. Then we have a pie chart, and a pie chart is this circle chart. So each wedge or slice of the pie displays the percentage of participants who provided a particular answer to the question. So the pie is considered a whole, and it should represent the total number of people in the population, or it should represent either 1.0 if you're doing a proportion, or 100% if you're doing percentages. Then each wedge should represent an independent subset of individuals included in the denominator of the pie chart. And so this would be, say, if you did a group of freshmen, sophomores, juniors, and seniors, you'd have a different slice for each one of those groups. And then figure 29.6 goes over a sample bar chart and pie chart, and here you can see the bar chart has spaces between each of the bars, and the responses on the bottom represent a different category. This can also be presented as a pie chart as well. Section 29.6 goes over normal curves and standard deviations. So here's some other statistics that you probably are familiar with from some of your other math courses. And so it talks about how the data are distributed and how the curves are presented. So a normal distribution is the standard bell-shaped curve that has one peak in the middle. And you can also describe the distribution by its kurtosis, which is how peaked or flat the distribution is, and the skewness, which is how asymmetrical the normally distribution is. And so here shows in figure 29.7, some differences in the kurtosis and skew. So we have here our normal curve here. Then we have a leptokurtic curve. I can never say that word. A platykurtic curve. And then we have a left skewed, a right skewed, a bimodal. So this has two different sections, two different humps of responses. So if, say, you were looking at freshmen and you were looking at seniors and you were asking them their knowledge about public health, the knowledge of freshmen is probably going to be a lot lower than seniors, so there may be humps in the distribution. And then we have a uniform distribution here. Then we also have variance, standard deviation, and standard errors as ways to quantify the narrowness or wideness of a distribution. So the variance is calculated by adding together the squares of the differences between each observation and the sample mean, and then dividing by the total number of observations. The standard deviation is calculated as the square root of the variance. And the standard error adjusts for the number of observations in the dataset by dividing the variance by the total number and then taking the square root of that number. So that tells you if there's a small or a large sample size. And so here are some of the calculations based on the data that we had for doing means, medians, and standard deviations. And here you can kind of see how they came up with those values. You have to start with the variance to do that, and then you can calculate the standard deviation and then standard error of the mean. So then we have these different curves, and I mentioned before that the normal curve is the standard distribution. And when we have that normal curve, we have 68% of the responses that lie within one standard deviation above or below the mean, and 95% of responses are within two standard deviations above or below the mean. More than 99% of those will be within three standard deviations above the mean. So there's a big chunk of them in the middle, and then as you go out 1, 2, and 3 standard deviations, there are fewer responses. Most people lie close to the mean. And so figure 29.9 goes over the standard deviations and this spread of where the individual data lies within the distribution. And so how do you interpret a standard deviation? So you could have a very small standard deviation in your data, and this indicates that most responses were fairly close to the mean. So most people had similar responses. If you had a large standard deviation, that indicates that the distribution of responses was very wide and that people had very different responses from the mean. There was more variability. A z-score is calculated to determine how many standard deviations away from the sample mean the response for an individual from within that population is. And a percentile can also be calculated, which quantifies the percentage of all observations in a data set that are lesser than a particular's individual value for a variable. So section 29.7 goes over reporting descriptive statistics. So this chapter has reported on descriptive statistics. The whole focus of the chapter has been on descriptive statistics. These are the basic characteristics of quantitative data, such as means and proportions. So if you have ratio and interval variables with a normal distribution, you're going to be reporting the mean and the standard deviation. So if you're writing up a research project, that is what you will include. If you have ordinal variables, ratio, and interval variables with a non-normal distribution, then you would probably report the median and interquartile range. If you have categorical variables, then you typically will report the proportion of participants or a percentage who provided particular responses for that population. And so figure 2910 goes over the common descriptive statistics by variable type. And so this is really good to see how you would present the measures of central tendency spread, and how they can be presented graphically for each of the different types of variables. So section 29.8 goes over confidence intervals, and confidence intervals provide information about the expected value of a measure in a source population based on the value of that measure in the study population. So a larger sample size will yield a much narrower confidence interval. Normally, a 95% confidence interval is what is reported. So it's usually reported, which means that 5% of the time, the confidence interval is expected to miss capturing the true value of a measure in the source population. And it is very similar to a p-value of less than 0.05. And so figure 2911 goes over interpreting confidence intervals. So let's say if we have a mean age of participant in years of 30, then the confidence interval is 26 to 34. And so this mean age is in the study population that you're trying to use as a representative of what the source population is. And so the interpretation will be based on the mean age in the study population. We're 95% confident that the mean age in the source population is between 26 to 34 years. And then that can also be done and interpreted very similarly with a proportion or percent. Section 29.9 goes over statistical honesty. And so researchers are obligated to describe their data accurately and correctly report the results of statistical tests. There are three different types of misconduct: fabrication, which is creation of fake data; falsification, which is misrepresentation of results; and plagiarism, which is the use of other people's ideas, works, or images without proper attribution. So when you do your statistical analysis, it should aim to discover the truth about a data set, not to creatively manipulate the analysis towards a preferred result. So you should select the correct test for the question being asked and variables being examined. You may have heard of phishing. Phishing is when they will say you fish within the data set to try and find some sort of statistical result. And sometimes it's okay to do further analysis, but you don't want to just typically continue to constantly fish to try and find something that's statistically significant, just so that you have that p-value or confidence interval that shows a valid result. So that is why it's important to have statistical consultation. So section 29.10 covers statistical consultants. This is when you consult with a statistician, and it should be done early in the study design process to ensure that sampling methods and the sample size are appropriate. The questionnaire is feasible and is valid and will present usable data, and the analytic plan is a reasonable one. Okay, thank you for listening.